Quality medication is an integral part of healthcare system aiding treatment of ailments. However, assessing medicine to deal with communicable and non-communicable diseases in Nigeria has been a huge burden for the healthcare sector, considering the fact that most of the drugs being used in managing diseases come from abroad. Reports have it that 70% of the medicines used in Nigeria and other African countries are imported from China and India. In addition, Nigeria also relies heavily on other countries for active pharmaceutical ingredients, equipment, and resources needed for medicine manufacturing. Apart from the huge demand on foreign exchange, the country's agencies have continued to battle importation of fake, counterfeited, and substandard medicines finding way into the country's supply chain. To check this and improve medicine security in Nigeria, many have called on the local manufacturing industries to step up production to meet the needs of the country under stringent monitoring and regulations. Though Nigeria is endowed with thousands of medicinal plants to be turned into potential drugs for management of diseases, the nation is yet to fully take advantage of that to encourage medicine security. Experts believe boosting local production of medicine can contribute greatly to the country's GDP, improve accessibility to drugs, and in general, impact on well-being of the population.
Let's introduce Dr. Obi Adigwe. Dr. Obi Adigwe is the Director General, Nigerian Institute of Pharmaceutical Research and Development. So you're welcome to the program.
Thank you, Kerry, and good to see you too, Jume. It's a pleasure to be here once again to speak with Nigerians about medicine security.
Let's talk about research and development here in Nigeria. We have more than 1,000 plants and roots that can be manufactured into medicine in Nigeria. And how have we been able to, skip the hurdles of having a fully functional research and development for medicine here in Nigeria? And how do we sustain and develop our medicine so that Nigerians can take medicines produced in Nigeria by Nigerians and that works for Nigeria?
Thank you very much, Jume, for that question. In your intro, one of your correspondents questioned the capacity of manufacturers in Nigeria to produce quality medicines that will be adequate for consumption of Nigerians. I can tell you categorically that in terms of capacity, there is no question as regards whether Nigerian manufacturers can fulfill the needs of the Nigerian population. Frank, the executive secretary of PMG-MAN, let the cat out of the bag when he mentioned that prior to my appointment as DG NIPRID, I was actually wearing the cap that he's wearing currently. And in that role, I traveled across various factories all over Africa, in Asia, in Europe. And I can tell you categorically that what we have in Nigeria, nobody else has the kind of potential that we do in this part of the world. 4 years ago, more than 4 years ago, I gave a press conference specifically to The Guardian on the 30th of April 2017. And I said that production of medicines to address local diseases is the ultimate aim of any nation with robust strategies to address healthcare challenges. Unfortunately, despite the great potential of the Nigerian pharmaceutical manufacturing sector, relevant policies and partnerships have either not been properly articulated or implemented to stimulate local vaccines production and medicines manufacturing. Currently, Nigeria has over 1/3 of all medicines manufacturing plants on the continent. We also have the highest number of relevant international quality certifications and awards in this part of the world. These are significant resources that can be leveraged within the right policy framework to expedite local vaccines production, not just for the nation, but for the entire continent. I made this statement close to half a decade ago, but the points I put out are valid even today. And you don't need to take my word for it. Google Dr. Obi Adigwe and medicines manufacturing. You see it there on the internet. Now, coming down to your question, Jume, it hurts me when people question the kind of capacity we have as researchers and scientists here. The institute which I lead, the National Institute for Pharmaceutical Research and Development, is peopled with world-class scientists. And over again, we've demonstrated it. We're the first agency of our kind to gain both the ISO 9001 and ISO 17025, which means that our analysis, our activities are world recognized. We're the first agency to develop a phytomedicine for sickle cell anemia. That particular phytomedicine is in use in 44 countries. Even during COVID, we're the first agency that undertook the analysis of the product from Madagascar and published our results. First agency worldwide, and based on the work that we did in NIPRID, we saved millions of dollars, countless lives, and ensured that the efforts were purposed to the right direction that are currently bearing fruit. We're the first agency to talk about a product which is currently being put forward for COVID-19, Niprimune. We've had that product listed by NAFDAC. We're now going to clinical trials. So the capacity is not the issue, Jume. We have the capacity. What is lacking is the funding, the resources, and most importantly, the correct philosophy. Most importantly, the correct philosophy. In terms of funding, the Nigerian government has recently boosted funding to NIPRID. At the early part of the COVID pandemic, I personally engaged the Speaker of the National Assembly, Right Honorable Femi Gbajamiamila. And even without taking my mask off, he said, I recognize you, valid point, pharmaceutical sector will be prioritized, and they've backed it up. But guess what? Nigerians and Africans have a way of abdicating their responsibilities for government alone. Development of the pharma sector is not what government can do alone. And I'll give you a good example. One of your intro statements talked about active pharmaceutical ingredients. In NIPRID, we have a model laboratory to concept manufacture active pharmaceutical ingredients and train other scientists on how to produce active pharmaceutical ingredients. That particular concept laboratory just needs a little bit more funding to get it operational. And when COVID started, we wrote to over 30 philanthropic organizations based here in Nigeria. We wrote to development partners and said, this is of value because India has just banned APIs. So if we can get this upstream, what it means is that we'll be securing our own medicine supply for our people. And out of the 30 people who we wrote who were philanthropic organizations and development partners, not one of them engaged us. Guess what? Using the same proposal, we wrote to 4 continental development banks. I have presented to the presidents of 3 of them. And one of them has taken it forward where all the proposal on APIs has passed 4 levels of approvals and is now waiting for their board chairman. So I don't understand how someone sitting in Abidjan, someone sitting in South Africa or in Egypt can see value in a proposal that has been raised by NIPRID. And yet, the philanthropic organizations in Nigeria, who them and their children will die if the medicine supply is cut off, cannot see value in funding the research that's going on in NIPRID. So whenever I talk about this, I really get passionate, and I sometimes it doesn't make for a good discourse. But capacity is not the issue, Jume. The issue is that Nigerians, Africans need to understand that unless you take responsibility for your own healthcare, unless you take responsibility to assure access to medicines, for you and your people. WHO, nobody is going to come here and do it for you.
Obi, from your voice, I can hear that it's quite frustrating not being able to get funding for research and development of medicine in Nigeria. Okay, thank you so much. We'll come back to you so that we talk.
The minister is always talking in our top management. We must look at the need to encourage NIPRID. NIPRID is better funded than before. And there's more attention now being given to NIPRID. And I'm glad that the DG is also very eloquent, making his own stories all over. If you do not come and tell your stories, at times people will not understand your story. So we need that, and we need more of that. And we need to be able to support NIPRID, support NEMA, so that we can churn out local content.
And let's join Dr. Obi Adigwe. They talked about policy, framework, regulatory, and capacity. Let's talk about capacity, which you mentioned earlier with, you saying that things are not working the way it should, getting funding, technology, innovation. If capacity is not well maintained, what happens to our medicine security in Nigeria? These young scientists coming up, if they get better offers to leave this country, what happens to our capacity to produce medicine? Dr. Obi Adigwe, please.
Yeah, thank you, Jume. That's a really, really good question, Jume. When I was appointed Director General of NIPRID, one of the first things I did was to hold a staff forum where I spoke to all my staff. Like I mentioned earlier, you cannot get a higher qualified set of people in the entire pharma value chain than we have at NIPRID. I have world-class scientists, about 8 or 9 professors, somewhere around 70 masters and PhDs, all aggregated at the various different areas where pharmaceutical development are situated. And in that meeting, I told them categorically that my number one priority will be staff welfare. And I am really, really grateful to my principals for having supported NIPRID so far. I had mentioned the work that we did with Speaker Gbajabiamila. We're very close with Chair Sununu and Chair Oloriegbe. And my supervising minister, Mamora, there is no week I do not touch base with him. I have an open door, and pharmaceutical manufacturing and harnessing our phytomedicinal potential is always on the top of his list. And with that kind of support, I was able to pull in a lot of external support that made me be able to keep my promises. And so within the 2.5 years I've been Director General of NIPRID, from a less than 6% of my staff who had access to official IT devices, as I speak to you, 100% of all confirmed NIPRID staff have been supplied an official IT device to support their work. I spoke to my friend who was at that time the High Commissioner to India, and he gave me 10 slots to train my staff in India at no charge to NIPRID. Consequently, things like access to power, access to materials, prioritizing from researchers' activities in terms of funding have all increased. And whilst there is still the risk of losing my star scientists, as I call them, I think some of these measures are some of the things that we've done to keep them in place. But it's critical to know, just like has been mentioned earlier, that anybody who has a PhD, and a really good PhD, who decides to practice under some of the onerous conditions we have here in Nigeria, is not just the patriot that person is an angel. I qualified, as you know, with a master's degree from the University of Leeds and a PhD a master's degree from the University of Edinburgh when it was at its peak, and a PhD from the University of Leeds. And based on my passion for this country, just like my father before me, who was sponsored by the British to do his PhD at Swansea, I came back to Nigeria to contribute. And I'm really grateful that at 3 various levels, at the National Assembly, at PMG-MAN, and at NIPRID, I've been able to demonstrate that we can bring value to what Nigeria is doing. But Jume, there's one thing I want to mention, because a lot of a lot of discussion has gone on in terms of policies, and someone will think that we're not doing anything in terms of policies. Let us be categorical, okay? In terms of policies, and in terms of an environment that encourages medicine security, where we are today is better than where we were 6 years ago. 6 years ago, we had the common external tariff, whereby products that were imported into Nigeria came at 0 duty, whereas products that were manufactured in Nigeria, people had to pay duty of up to 20–30% for their equipment and inputs. As Executive Secretary of PMG-MAN, I joined the team that traveled to 15 ECOWAS countries to work towards reversing that policy. 2016, based on our engagement with the government and based on government's receptive ears, we pushed forward the 2016 fiscal policy. That fiscal policy is a policy that ring-fenced 4 categories of medicines for local manufacturing: antibiotics, hematinics, alkaloids, and antimalarials. That singular move by this government has, from our analysis, led to new establishment or refurbishment of close to 20–25 factories. And at the last time we did our analysis, an inflow of close to $100 million into the economy. This administration also put forward the Executive Order number 3, and where it says specifically in subsection 4 that locally manufactured pharmaceuticals will be prioritized, and went on to add Executive Order number 5 that prioritizes the utilization of indigenous science, technical engineering, and other potentials as inputs for the industry. These are all policies that are in place to encourage medicine's security by utilizing and harnessing our potentials. And finally, even before COVID came on board, this administration also put forward 3 billion naira to look at local vaccines manufacturing. For the first time in history, government put forward 3 billion naira and partnered with a local manufacturer and formed the BioVaccines Nigeria Limited company. If we had not done that about 3–4 years ago, as at today, we would have been at a negative position, not even ground zero. So these are some of the policies that people should know about and at least appreciate, because we say when you appreciate what has been done for you, more will be done. Now, don't get me wrong, I'm not saying we're at Uhuru, nowhere there. I like how some of the previous debaters and contributors mentioned prioritization. I want to look at prioritization from a slightly different level. In Nigeria, we keep hearing about hundreds of billions that's voted to the food sector, hundreds of billions of dollars that's voted to the security sector, hundreds of billions that's voted to textile. I will be very categorical about this, and if I'm wrong, I will eat my heart. There is no sector in Nigeria who has higher priority than the pharmaceutical sector.
Very, very briefly, but if you like, why don't you dwell on the issue of complementary medical alternative that we could apply? Of course, we've spoken much about the orthodox method.
Very much, Kirian. I think it's better to dwell on what is most important, and that's changing our philosophies as a people. And in one word, what we need to start looking at is prioritization at 3 levels. stakeholder prioritization. All stakeholders, multidisciplinary, need to realize that the pharmaceutical sector is the biggest sector that they can begin to play in. Currently, Africa does $50 billion every year. With the AFCFTA and with the COVID outcomes, that 50 billion is set to grow by 10 to 20%. Unlike agriculture, where you have the East Africans, and solid minerals, where you have the Central Africans and the South Africans. In terms of pharmaceutical manufacturing hub, nobody owns that space now. And nobody is better placed in terms of potential to play that role than Nigeria. So Nigeria has an opportunity to emerge as the pharmaceutical and phytomedicinal manufacturing hub for a market that's going to be worth 50 to 70 billion per annum. That, if put together properly, can contribute somewhere between 15 to 20% of our GDP. That's the message for stakeholders. For government, government has started well. Increasing budget to NIPRID, increasing attention to policies for the manufacturers, but more needs to be done. And I want to thank people like you and Jume there in the studio for the good work that you're doing. It was on one of these sort of programs that somebody in the highest office in Nigeria saw us and invited us to come and make a presentation. And I'm going to shock the entire Nigeria with some very big announcements very soon in terms of phytomedicines. So more needs to be done. We thank government for what they have done, but more needs to be done. Thirdly, and most importantly, personal prioritization. I give people this story. My two daughters were born at Leeds General Infirmary. And while I was doing my master's and PhD in the UK, I used to buy medicines from Nigeria to take it to the UK for them to use. People have this erroneous thinking in their head that if a medicine is made in Nigeria, it is of less quality than that is imported. It's not true. And I'm telling you from personal experience, if you go to the pharmacy and you want to purchase any medicine, ask them first, can you give me the one that's made in Nigeria? That is what you need to do to ensure that you and your family have the highest quality medicines and that you're contributing to the national socio-economic development.
Thank you for watching. For regular updates in health sector and human research and development, click on the subscribe button right now. Remember to like and share as well.